Fillings and crowns are one of those very common basic dental procedures that surprisingly patients have quite a few questions about, and I can understand why, because they haven't been explained the reason why we choose a filling or the reason why we choose a crown. It boils down to just strength. A filling is done on a tooth that has a smaller cavity and has lost less tooth structure. A crown is done on a tooth that has lost a significant amount of tooth structure or is going to lose it because there's a large cavity in the tooth. So when we do things in dentistry, we don't just do them to fill a space that has been created. We also do them for strength, because what patients need to understand, and I think a lot of times they don't understand this because it hasn't been told to them, is that you've got to be able to function with whatever we're putting in your mouth. You've got to be able to chew. And I'm not saying open beer bottles with your teeth. I'm saying normal chewing. You don't want to be chewing on something that's going to break on you. And that's really one of the reasons where we make that decision. We make that call. Hey, this is going to work just fine with a filling. Or other times when I tell the patient, you know what, this needs to be a crown. And the reason we choose a crown is because we want to make sure that the tooth doesn't fracture and then eventually need to be pulled. And that's a worse outcome than just going ahead and getting the crown done. So we, as dentists, sometimes are fortune tellers, and we're trying to guess what the potential risk of that particular tooth is and making a decision based on what we think could potentially happen, so that we're preventing the patient from going down that road and losing the teeth. Because at the end of the day, really what we're trying to do is keep everybody's teeth in their mouth for the rest of their life, and that's really the goal.